Well, hello everyone. Welcome to Friday's report out. It's good to see you all. Hello, my name is Julian. It's great. We've got some really good items on today's report out, and we're going to kick off with an update from the Paediatric Accident and Emergency Department on improving the patient experience, reducing delays for patients referred from the ED to the Children's Hospital, and it's the 60-day review, and we've had some great updates from this team before, so really looking forward to this. So I'm going to hand over to the team. Take it away, guys.
Thank you, Julian. So I'm Sam Verity. I'm one of the senior sisters in paediatric A&E, and I've taken over this work from Katie Lambert. So our 60-day update. So each PDSA team has worked hard on taking their projects forward. The patients' numbers and acuity has continued to increase since the start of the Kaizen event and the 30-day report out. Therefore, great achievements made by all to continue with the work. There's some positive changes that are evident, and we've got some audit data as well that we've received. There's clear plans in the PDSA cycles for moving forward for the 90 days. Next slide, please. So outcome one was the update of the role coordinator role. So it's looking at the efficiency of the communication between the coordinator in PZD and the bed managers within the Children's Hospital. There has been some positive feedback of the bed managers team and of the coordinator role, and they continue to carry a coordinator phone and a badge that says that they're the coordinator. There seems to be a little bit of problems with embedding this completely. Talking to staff within the department, I think it's more of a habit. So a lot of the calls that are getting sent through to the bed managers are on the 25548, which is the phone that sits next to the coordinator and the phone that we used to always use to do those requests for beds. So it's just about trying to embed it further within the team and just reminding them, even though they've got the phone on them, they just forget sometimes. We also made a repeated observation board. So the child comes in, they have the set of observations done on the initial assessment, and then we aim to have a repeat within the hour so that when the doctors get to see them, they've had two sets of obs. We've also further allocated another nurse to the coordinator end to help with the jobs on the job board as well, as our tendencies have started to increase. Next slide, please. So audit results. There's been 132 patients that were TCI'd between ED and the bed managers in this time. Of these, 111 were rated sufficient, 21 not efficient. A total of 148 calls have been received and documented for these patients. Coordinator was 74 times, nurse in charge 15 times, and others 59 times. Communication and therefore efficiency appears improved with the introduction of the coordinator contact and phone, but it does need further embedment. Next slide, please. So the outcome two was looking at the portering services and if we could improve the patient journey by the patients walking themselves to the CAT unit as opposed to CARPSing every patient that needs to go. So auditing from the data from the 5th of April to the 25th of May, 838 children went to the CAT unit from the emergency department. And this data is extracted from Symphony, where the discharge destination for patients booked into ED on the Symphony is for CAT or LCAT. For the same period, 602 porters were CARPs between PDD or ED X-ray in the CAT unit. And this data shows 28.1%, 17% of families are not having porters to take them to the CAT unit. This has decreased slightly since the 30-day report out, which it's at 30%. However, we think that this is due to a high influx of much higher acuity patients that we're seeing within the department who wouldn't have been suitable for unescorted transfers. So a total of 236 porter journeys were saved over this period, and this represents a significant cost saving to the trust and frees up porter times for other tasks. Next slide, please. So outcome 3 update is referrals. So updates from Ken Books reviewed. It remains occasion to delay referral due to CAT as unable to contact team. The phone on CAT is now working effectively and a change in number. Visual observation supports improvements since the change. The CAT QI work has relaunched with plans to include work on updated referral methods. Next slide, please. So we audited throughout May, TCI target time of 30 minutes. 15 random patients were selected throughout the month with an average time of 30 minutes. The quickest time from TCI to leave in the paediatric department is 8 minutes, and the longest time being 57 minutes. The visual audit of the referral process, basically CAT's capacity for patients is now causing delays due to higher attendances and acuity of patients for hot and cold patients. And this is reflected in what we're seeing in PZD at the moment as well. Next slide, please. So we looked at further signage in place to aid parents' movements throughout the hospital from PZD to the CAT unit to make it easier for them. So the original phone number is now working with a second backup referral number, and we will continue to audit this throughout June. Next slide, please. So this is a new map, so it's been made much friendlier. And then the pictures of the animals are dotted on the walls as you go round to the CAT unit, so they follow the map to get to the destination. Next slide, please. So going forward for the 90 days, we plan to gather and review overall observation data to review the target of less than 30 minutes from referral to leaving the department to the CAT unit. We'll continue to develop and embed the use of the jobs board in PDD, and we'll further embed the coordinator role in PDD and improve communication efficiency with the PFC team, audit the data and team feedback. Next slide, please. And that's it. Any questions?
Sam, that's great. Thank you so much. What we'll do is we'll save questions up for the end.
Okay.
So we'll have a Q&A session on all of the items for report out today. But just to say, really, really good work. I do appreciate that we're much busier at the moment, aren't we, in terms of attendances. We're seeing that, I think, across the whole NHS, actually, but particularly in children's. I do really like I love the animal map. I think that's a great idea to kind of help navigate through, because it's not necessarily a straightforward trip, is it, from ED up to? So that's really good to see. And obviously, please do, as I know you do, escalate any real difficulties or challenges in relation to the sort of congestion in the department, and particularly given all we're having to do with IPC measures as well, it gives it added challenge, I'm sure. But really good to see the work that's going on. So thanks very much for reporting out on that.
Thank you, Julian.
Okay, great. So next, we've got the Ellen Road vaccination team to give us an update on the vaccine programme update, which of course regular attenders at the vaccination team are regular attenders here at Report Out, and really good to see the level of progress that's been made, and probably never has it been more important to ensure that we're vaccinating as many people as possible with the new variants of concern. You know, that are we heard last night from the Secretary of State are covering you know, in terms of transmission, a larger number of the population. So let me hand over to you, Gareth. Are you kicking us off?
I am, Julian. Thank you.
Great. Over to you.
Great stuff. Good afternoon, everybody. For those of you who don't know, I'm Gareth Dolby, the General Manager for the vaccine programme here in Leeds. And I think that's a really good introduction for us, Julian, actually, because to date and today, we delivered our 200,000th dose between the Ellen Road and the Thackeray site. So that's a really good milestone for us. And over the weekend, we're expecting tomorrow to deliver the 150,000th dose at Ellen Road. So really making some great inroads into delivering the vaccine for the population of Leeds. Next slide, please. And we thought it appropriate, this report out as well, because we haven't had this opportunity thus far to just celebrate the work that the Thackeray has done and contributed to that. And we delivered over 52,000 doses of Pfizer at the Thackeray from its time that it was open. And the legacy of the Thackeray is still playing its part in terms of our improvement work that we're delivering and how we improve upon the processes that we've got in place. And not only that, it's influencing how we work our future plans up in terms of the next phases of the vaccine rollout. And also we're using that learning as part of those national calls that we've been on, and other centres around the country are actually using us as to model some of their improvements on, and likewise we're using some of theirs as well. So the learning across the whole piece is absolutely fantastic. Next slide, please. So the last few months for us at Ellen Road has been extremely busy, going through our PDSA cycles and implementing some serious changes. We've now got 2 doses on site, or 2 different vaccines on site, which come with its own challenges. We've gone through a series of checklists and forms that we've had to tick off to make sure that we're safe, and we're ensuring that our quality is up to the highest of standards to use 2 vaccines on site. And we've also implemented an electronic process to help streamline the service, and also make sure that we're using what capacity we've got for the demand and make it to the most optimum. And I'm going to hand over to Hannah now, who's going to lead us through that journey and tell us where we are. Thank you, Hannah.
Hi, next slide, please. I'm Hannah. I'm one of the nurse managers here at Ellen Road. So like Gareth said, we've been tasked recently with becoming paperless. So with improvements, we've been presented with some new challenges. So initially we had the centre set up so that we had 2 vaccinators in each pod where we deliver the vaccines with 1 healthcare professional. And the healthcare professionals were assessing before then the vaccines were delivered at one sort of final destination within the pod. So what this meant was we found that people were queuing in one long queue and becoming sort of very acutely aware of how long they were queuing. It felt quite disjointed because we were having to pull people away from the queue if they needed further assessment, so more in-depth assessment, and then feeding them back into the queue. And I think that staff also felt quite time pressured because we were trying to get each citizen through each pod in just 3.5 minutes. So we decided to make a few changes. So next slide, please. So we broke up the queues by separating out the assessment into the assessment areas, which we had previously done when we used paper. So we acquired some iPads from NHS Digital, and we've been using those to do the assessments in the assessment pods before then asking citizens to queue again to queue into the vaccination pods where they receive their vaccines. So we've been trialling this, and we've been trialling it with different staffing models. And straight away, we've got so much positive feedback from the staff. They feel like they're under less pressure, that we're able to have in-depth conversations with citizens if they require a few more questions answered and what have you. The atmosphere within the centre feels so much better already. So it's still sort of in its infancy. We're going through the PDSA cycles at the moment and producing standardised work. But yeah, it seems to be doing well, and we're making great improvements. Next slide, please. I'm just going to hand over to Jack.
Hello, everyone. My name's Jack. I've been working in admin since January at Ellen Road. From admin's perspective, the new system has been much better. The patients come up to the reception desks are much happier. They've been queuing for less time. And on our end, we were training the vaccinators and the healthcare professionals in the beginning, but now we have super users, so the nurse managers and things like that can train them as well. But we stay down there in the sense of just admin support if needed. And the actual team dynamic has improved massively, because before admin was separated in a different building, but now we're actually interacting with the nurses and Home Kelly security. We just feel much more connected as a team, and yeah, as I said, it's just a much better team dynamic. And yeah, that's it. I'll pass it over on to Adam.
Thanks, Jack. Next slide, please. Yeah, hi, so my name's Adam, and I normally work at the Trust as a Senior Medical Deployment Officer, but I've been seconded to the Vaccination Centre as one of the Assistant Workforce Managers and a Process Owner. So when we talk about the journey that we've been on, I think it's really important to to understand where we are now versus where we were in those initial setup stages. As we started, we had a huge surge in booking anyone and everyone that could possibly help, and we very much found ourselves as just trying to get bums on seats. And then we became inundated with an overwhelming amount of phone calls and emails of support to help out with the programme. And this consisted of people who have retired and returned, people have been redeployed and seconded to us from elsewhere in the trust and our other communities as well as we've had students come to us and a whole host of different recruitment pipelines. We found that trying to mimic a lot of our normal sort of LTHT practices and processes was not the easiest of tasks, especially as we've had specific sort of reasons and specific requests that we've had to do, like any other service that we've had before. One of the most fundamental elements of our workforce success and the sustainability was the introduction of our self-booking for these rosters, which allows the staff to log on to their employee online accounts, review our available shifts and book on as to what would best suit their work-life balance. This approach has definitely helped our uptake of a more consistent, overall positive and productive workforce, particularly as we've worked to manage each of those individual expectations and whether that has been as us as a service or them as a member of staff. As we worked our way through the programme, we have worked through individual working patterns, contracts and annual leave, which has helped the building of our sort of business as usual mentality. Constructing our policies and SOPs mainly from scratch has demonstrated how volatile and fast-paced this centre actually is. As the goalposts are changed a lot of the time from 1 hour to the next, part of our daily management is looking at our staffing figures, anything from 1 to 7 days ahead, so we can assess our areas of concern as soon as possible and escalate these accordingly, especially when we come to understand what our demand and vaccine supply actually is. As a team, we do communicate through numerous calls, Gemba walks, as well as using our virtual production board via Trello, which helps us centralise any real important pieces of information, any hot topics, along with team shout-outs and celebrations of success as well. This is also a helpful resource for anyone who's not been able to attend these meetings, who are working from home. So they've got the opportunity to catch up on anything, and those as well that have been on leave, so they can catch up what's been going on and what the team are currently on with. So there's not a delay in working. Once you've come back, you don't have a huge catch-up period either. So then working collaboratively as our own sort of CSU, we're now starting to see the light at the end of the tunnel to a more sustainable and competent workforce. Next slide, please. So as a result of all the collective efforts with everyone within the vaccination centre, we have seen significant uptake in positive feedback. We actually surveyed 55 members of staff and asked them 3 questions, offering positive, neutral and negative words to describe their experience. And as you can see from the graph, the staff now feel very well set up for their shift, with the 93% of the 55 admin and clinical staff feeding back positive responses. And the effectiveness of the team work reflects how we have achieved such great improvements across the vaccine centre. I'll now pass you over to Suzanne, and next slide, please. Thank you.
Hi, I'm Suzanne. I'm one of the quality improvement coaches from LCH, and I've been supporting the improvements at the vaccination centre since January. So these are the latest timed observations of the patient journey through the centre, which shows the lead time for AstraZeneca, the AstraZeneca vaccine, still slightly higher than the baseline measure of 11 minutes and 21 seconds, but we have seen more questions being asked regarding the increased risk of blood clots, so that might have impacted the time. The latest timing for the Moderna vaccine is 22 minutes and 48, which is significantly improved from the original baseline measure of 45 minutes. And as you can see, time in pod is relatively the same for both vaccines. Next slide, please. So the use of the 5S methodology is continued within the storeroom at Elland Road. We have now recruited a part-time stock operative, Kennedy, who along with Jimmy from the KPO team now manages the storeroom. So there is now an embedded process for stock organisation and ordering, with shelves organised in a logical order and items frequently needed throughout the day are closest to the door. Kanban sheets are in use, allowing for a visual prompt when stock levels are getting low, and a price tag has also been added to some of the shelvings to help support the reduction in wastage. For example, to prompt staff to clean and reuse goggles and face shields instead of getting new ones at every shift. A laminated order sheet is also displayed so staff can clearly see what and how much of an item is expected into stock. A 5S box has been placed in the storeroom for any items that are surplus to requirements or have been sent incorrectly that need returning to store. Kennedy's role has also been expanded, and Kennedy is also now responsible for replenishing the stock inside the pods. So at the end of the day, Kennedy will replenish what is needed and ensure that we're not overstocking the pods. A 5S team has been created with nurse managers, Kennedy and Jimmy, to ensure that everyone is kept informed and up to date on any stockroom news or information, particularly for when Kennedy is not on shift. And most recently, Jimmy and Kennedy have put together a communication board so staff can leave feedback or they can add any ad hoc stock requests. And the team have also now organised for the Elland Road site cleaners to sweep the rip floor and remove any empty boxes at the weekend when Kennedy's not on shift. And feedback from the staff in the centre, they feel that the stockroom is now a pleasant and safe area and it's easy to navigate, and staff can easily find what they require very quickly and very easily. Next slide, please. So as you can see, overall patient experience for the last couple of weeks remains high. So 99% of respondents reported a good or very good experience of their journey through the centre. We slightly amended the FFT questions recently, and one of the new questions that we're now asking citizens is if they received information on the vaccine they received. And as you can see, 94% indicated that yes, they did. However, there was 6% who didn't. So we are reiterating to staff to always offer a vaccination information leaflet to every citizen who comes through the site. Next slide, please. And these are just a selection of some of the feedback, the narrative feedback that we've received. The green is positive feedback, so finding that staff are very pleasant, is well organised. The blue is a little bit of the less positive, which generally recently that's been related to the queues that we've experienced at the centre. Next slide, please. We have a fabulous patient partner who is very engaged with the work we are doing at the vaccination centre, and it is a key member of our improvement journey. So Dolph brings the patient voice to our meetings and improvement events and has made a positive contribution to the work we do. So this is just a quote from Dolph of how he has found the experience of working with us. Next slide, please. This is the final TPR from Zachary, and as you can see, all metrics are in green, which is a really good final position for the site to finish on. Next slide, please. This is the latest TPR from Elland Road, and as you can see, there are two metrics that are in red. As discussed previously, the lead time for the AstraZeneca vaccine, which we'll continue to monitor in the coming weeks. And as we've moved from the paper consenting to the electronic consenting, a new quality defect has emerged, which is relating to the vaccine information not always being saved on the system when the patient has been through the pod. So to help reduce this from happening, we've put in several measures to hopefully prevent it. So we've put a visual prompt and a visual reminder at the laptops, which you might have seen on Jack's slide. And we've also reiterated the saving aspect at training. So when the vaccinators come through the training, that is reiterated as a really important final step to do. We're also developing a standard work plan for the vaccinators to put some standardised processes in place. And we've also put in a request to the National NIVS team if they can add a warning flag onto the NIVS system itself, or even if we can prevent the vaccinators from moving on from that page before they move on to the next patient, that they have to save the current page. And hopefully that will help reduce those defects that we're seeing coming through. That's it from me. I'm going to hand over to Gareth. Next slide, please.
Thanks, Suzanne. I think as we know that when we're implementing change and these improvements, a consequence of sometimes putting these changes in place are that it throws up more barriers and more challenges that we have to circumnavigate to make sure that our service is running to its optimum. And I think one of those that Suzanne just touched on there was around the queues. And when we first changed over to the electronic system, we did see an increase in our queuing, and we've gone back round that process now to ensure that we don't have the queues as long as they were. But that depends on the numbers coming through the centre as well. So sometimes we have to be a little bit reactive rather than proactive to work it through. Suzanne also touched there upon the NIVS and the software and some of the challenges that we're having around that. Sometimes we're at the mercy of our NHSEI colleagues and the system administrators who are building these programs. So sometimes it does take a little bit more time to overcome some of the challenges. And then the staff training on the NIVS as well, just to bring out another one, was a challenge that we had around making sure that all the staff members had the training before we set ourselves off on this journey. Next slide, please. So although we're still very early on in the programme and our lessons learned are sometimes few to be able to put down on a piece of paper, because we're still going through the PDSA cycles, we're still understanding how some of our improvements and our changes that we're implementing in the service are actually gonna roll out. One of the big lessons learned that we got from implementing the electronic process was just to ensure that all our staff had the right access, and that meant that we were setting our staff up for success from the outset. And as Adam, Anna and Jack have all alluded to with our staff feedback, and we've got a happy team, and the team dynamics have changed to be a bit more personable in some cases, rather than just seeing a name on a piece of paper, as Jack alluded to. From the admin perspective, it's actually brought us closer together as a team, and it is such a big team that turns over on a regular basis, 2 shifts a day, that this is key to some of the lessons that we've learned around communication and ensuring that the team know each other. And we're implementing more and more of the staff focus groups to get everybody together to get that communication out far and wide. So next slide, please. So I think it's worth noting that this morning you've seen 3 or 4 of us, 5, that have come to present on behalf of the whole programme. And Katie put a comment into the chat a little bit earlier on to say, you know, the team together have still got the energy to improve 5-6 months into the programme that is supposed to be short term. There's a lot of energy going in, and the consequence of short term high volume projects are that we need people in the centre 12 hours a day, and tiredness can set in quite quickly. So it is a dedicated and committed team to the programme. So just a thank you on behalf of myself and everybody else to the vaccine programme for everything that everybody's doing. And I'll hand back to yourself, Julian.
Wow, thank you, Gareth. What a great, well, not single, set of report outs. Great. Some incredible milestones there, Gareth, aren't there, in terms of the where we're up to? And it's really good to see the application of the method at all levels, really, and in every part of the process. So a big thank you to the whole team on that. Really excellent. So thank you so much for that report out. I'm going to move us on now to, always a pleasure, this Lean for Leaders certification, and it's our very own Tim Hiles. Are you there, Tim? You could stick yourself on camera if you are. Here he is. It seems strange, Tim, that you know, it's it's probably one of those that I know you've done. You've probably already deployed so much of the Leeds improvement method. This feels like a sort of well overdue moment, I guess, for you. So well done on getting through all of the homework and getting it all done and signed off. But goodness me, you must have more than enough real world examples of what you've done in terms of deploying the method. So that's absolutely fantastic. Did you want to say anything?
I'll very quickly, if I don't mind, Julian.
Yeah, please.
I mean, I suppose, as you've alluded to, I was involved with the improvement method right at the start of the partnership with the Virginia Mason Institute. I was actually on the steering group for Value Stream 2, I think it was. Less positively, I was due to be on cohort 1 of Lean for Leaders training, and I swapped with a colleague to cohort 2, which was 1 day later. So I'm slightly ashamed at how long it has taken me to get this certificate. And as you say, I've been involved in using the tools quite a lot, and have supported and encouraged staff to use them. I really do believe that they work in providing a toolkit that can be chosen from, and that idea of putting the ideas for change back to the people who are doing the work is one that I absolutely agree with passionately. I suppose one of the things that I do say to people is don't be overawed by the range of options that you've got and the number of tools that are described when we go through the training. And just, have a go, pick something, have a go with it. And I suppose that one of the bits of learning that I've got from this process is I precisely did not do that with my homework. I saw it as a big piece of work that was unachievable. And I'd just like to give a shout out. She's on leave today, but Sophie Williams gave me a bit of a kick recently and saying, why haven't you done it? Let's get you through this. It's not that much. Get involved in the vaccination centre, and doing some of the work with the team here has helped enormously. So I suppose my advice to people, if they're doing it, is don't overthink it. Get stuck in. Ask for advice and support, and find somebody that you work well with, and don't overcomplicate things. Yeah, and that's it. I'm more pleased and proud than I ever thought I would be to have got this certificate finally.
Well done, Tim. Great. I'm really pleased. And if you sort of imagine I'm handing you this certificate over the virtual environment, but well done, well received. I'm sure it'll find a place somewhere where you remind yourself of all the work that's gone into it. But I absolutely agree with the point you just made there. I found this myself, about the fact that it's not a counsel of perfection, is it? It's kind of, it's using it practically and doing it and deploying it. And you've done that in so many ways with all the work you've been involved in. So well done. I'm delighted to award you that. So what a great report out, guys. Really good. So we have got some time for questions. So please do feel free to ask questions. Remember that we've had the great report out we've had on 60 days paediatric accident and emergency department. A huge amount to get your teeth into on the sorry, I'm just running out of juice here. Plug myself back in. On the vaccination team, and then perhaps anything for Tim. Any of you either thinking of doing, or have done Lean for Leaders? So questions. Who'd like to kick us off? You stick your virtual hand up, or just come in if you can't do that. But please do, because there's plenty there today, isn't there? So Liz.
Hello there, it's Liz from Pharmacy. We were talking yesterday in our team about how easy it is to build improvement into a new service, and I'm just so struck with all the work that's gone in the vaccination centre. I just wondered if anyone had any reflections about how easy or things that we might think about when we want to really embed it, when we're thinking of changing things? Gareth, I can see your camera going on. That would be really helpful, because I think, like Tim was alluding to, it feels scary, but actually what you see when you see the results are amazing.
Yeah, absolutely, Liz. Gareth, did you want to comment on that?
I was going to come in, Julian. Thank you. I think there's a couple of points I can bring out from that is, as you were saying before, Julian, about how much work we've done on the improvement side and how much it's been embedded. Actually, this is across multiple organisations as well. So, you know, and third sector. Some of these organisations don't even have the Leeds improvement method or that kind of lean methodology from Kaizen implemented in their organisations. So I think one thing what we've learned from that is just the communication and getting everybody involved. And I think going off of what Tim said about it's not scary. Actually, if we just put our minds to it, we can overcome some of these challenges. The other thing I was going to sort of touch on is how quickly things become embedded as the norm. And actually, it hasn't been easy in some cases. When we tried to firstly go to the electronic process, and quite happy to be candid here with what we learned, was that people were like, why do we do this? We've always done it this way. And that was only after 4 or 5 months of being on a brand new program with brand new processes. And we did come across hurdles at that time. So it has been challenging along the way. I think the key to it all was just getting everybody on board from the start with the changes.
And that point, Gareth, you made about different organisations, that's something that we, in fact, just yesterday brought together all the organisations across the city, including the voluntary sector, to talk about improvement and how we might together do this on a much broader footprint across the city, and have an improvement-led approach to the challenges that we face over the coming years as we try to forge an integrated care approach across the city. So that's really good to hear how the vaccination program's kind of blazed a trail on that. Phil.
Yeah, thanks, Julian. Just to say, big well done to the team. Immensely proud of everything that you've achieved across the system in this programme. Just an observation, it's just been absolutely fantastic. And what I think is great is just that permissive culture that you've got in the programme, so that you can keep making those improvements. You get a real sense that nobody has to kind of double check with somebody whether they can go off and try something or think about it or want to improve it. I think that's a really great culture. So that's down to the team itself. My other observation, I guess, is I just love the fact that we've leaned out the language. So I don't think I heard any Japanese words through the presentation, which is interesting that we've kind of arrived at what the language we want to use is, and you know, nobody's using a lot of complexity in what you're all describing. And I wonder what you think about to what extent that's actually helped people feel part of this and not overwhelmed by the sort of idea of complexity of the method.
Yeah, good point, Phil. Any thoughts on that from the team? Tim?
I was going to start with saying I came in today and walked around the Gemba and saw Daily Kaizen at work, but I think just building on what Liz was saying, though, I think embedding the methodology right from the outset made it to some extent easier. We knew we were introducing a new process that would need to develop. As Gareth said, processes become the norm really quickly, but knowing that we were going to change right from the outset was really helpful. And I do think that those conversations with the staff about what needs to change, rather than talking necessarily about the process or flow, where have we got bottleneck became sort of the thing. What was the next bottleneck to tackle? So I do think that the way it was addressed with the team was important, and it didn't overawe people in terms of talking about the map of the process or the, you know, talking about the Gemba or things like that people wouldn't have necessarily understood straight away.
Yeah, absolutely. Jack.
Hi, sorry, just wanted to add to what's been said. from my perspective working here, until this job, I'd never worked for the NHS before, and I only just graduated before, and that atmosphere is what has been on throughout. Like, I always felt I could give my opinion and people would listen, and it would lead to things like that. And I just wanted to sort of highlight it again to say that is the atmosphere of the vaccination centre. It's been really nice working here.
That's really, really good to hear, Jack. Thanks so much for your feedback there and sharing your experience. Tony?
Hello, Julian. Hello, everyone. As outside eyes, just listening in on the conversation, I heard two things which I think come together. One is Tim's comment about the methods, the method being a toolbox which can be dipped into, and the tools can be used. And then I heard Phil talking about making the language Leeds-centric. And I think these two things come together. They're very, very important. It's important that what we have is ownership of the Leeds way. It cannot be the Seattle way or the Tokyo way. It's got to be the Leeds way. And therefore, what we've got to get hold of is how we do it around here. And the two things, and I think the realization that what we're giving people are tools that they can use, rather than slavishly giving them a set of processes to follow, is a much better way, because it empowers the user to determine which tool to use for which purpose, and that's the Leeds way.
Yeah, great points, Tony. Thank you very much. Suzanne?
Yeah, I was just going to listen to that. I mean, it's been great for me coming from Leeds Community Trust supporting the centre, and I think there's two key things for me from an improvement point of view, and it is, as mentioned, that permissive environment to start off with, and also the commonality, I think, for everybody who is involved in improvement is actually they want to improve for staff and for patients, so anybody who touches the centre. And that's been the key, and everybody has been, although it's been tough at times as we've introduced new processes and new systems, actually the key driver is that we're making improvements for everybody who touches the centre, and everybody has that in common, and it's been really great.
Fantastic. Thanks very much, Suzanne. That's great. Wow, what a great report out. And many thanks for your input and your questions and discussion. And most of all, thanks to presenters, all of you who've reported out today. Really, really good. It's what makes it in terms of the sharing the experience and the improvement. And I hope that those of you who have listened to today can just go and share the feedback from today, and particularly convey the sense of possibility, purpose and inspiration that we get from this. And thank you to the KPO colleagues who are there to support all of you in this work, and themselves do a fantastic job creating the framework for our improvement and educating and training and supporting what we do. So thanks very much, everyone. We'll see you all hopefully same time next week. And well done, everyone. Thanks very much. That's the end of Report Out. Thank you.